does manual therapy help with low back pain or sciatica? Are you suffering with low back pain or sciatica and you're struggling to figure out who it is that's the best person to see? Or maybe your friend went to see a manual therapist and you're just wondering, how does that even work? And what's the difference between them and regular physical therapists and all of those questions? That's what we're going to answer today. So we're going to explain today what's the difference between a manual physical therapist and a regular physical therapist, as well as discuss things to look at to see if manual physical therapy is what you need to help with your low back pain or sciatica. Now, I want to start off by talking about chiropractors because so many people think low back pain or sciatica, you need to go see the chiropractor. And I just want to explain the difference between manual therapy and chiropractic, because chiropractic can be helpful for low back pain and sciatica in the short term, and that it can help get the spine aligned. That's what chiropractors are focused on, is being able to get that spine in alignment. And it can be really effective when you are in that acute stage, when it just happened. However, what they don't address is all the soft tissues. So the ligaments, the muscles, the tendons, the cartilage, all of those things are not really addressed with chiropractic. So if you find yourself going to the chiropractor regularly, I mean, I'm not talking about once a month, right? Once a month, okay, fine. But if you're going to the chiropractor regularly or multiple times per week after a couple of weeks, then probably you need to add somebody else to that program because you're not quite getting those results that are sticking with you, right? Now, again, when things are really flared up and really hot, sometimes you do need to go a couple times a week in those initial phases. However, if you're beyond that and you're still having to go multiple times per week, it's because the other tissues are not sticking or doing what they're supposed to do. So the chiropractor is getting the spine in line, but the muscles, ligaments, tendons, whatever, are pulling it back out. And that is definitely a case where a manual physical therapist can come alongside and be very helpful. Now, manual physical therapists can do joint mobilizations, and some are even trained to do manipulations like chiropractors do. However, it's a very tender area between chiropractors and manual physical therapists on this. So I don't like to limit what manual physical therapists do by saying they do manipulations. They can, and we are trained in it. However, we're going to look deeper. So we're not just going to look at the joint and if the spine's in a line. We're going to look at everything else. We're going to look at the soft tissue, so the muscles, the joints, the ligaments, the tendons. How is the cartilage responding? All of those things to determine what it is that's the root cause, because sometimes your spine can be in alignment, but other things can still be dysfunctional. So what does a manual physical therapist do, and how are they different than regular physical therapy? So the first thing is we're going to make sure that the joints are moving correctly. So again, I was talking about how the chiropractor is going to make sure that your spine is in alignment, which is fantastic. But if it cannot move correctly when it is in alignment, well, then you're going to go out of alignment. So manual physical therapists, one of the things we focus on is making sure that the joints are moving correctly, because when they do move correctly, then they're more likely to stay in alignment where they got put in the first place. Okay? Second thing we're going to work on is decreasing tension in the muscles. So you may have seen someone who was able to get things moving and everything in alignment, but a couple days later you feel like everything's out again. So that's because the muscles get tight and they can pull joints out of alignment. And that's going to keep being perpetuated unless you deal with the muscle issue. So we need to get the muscles to be able to A, relax, but B, function correctly, because muscles are supposed to contract and relax, but we need to teach them how to contract and relax. So that's the next thing we're going to work on. That's kind of the next layer, is to make sure that the muscles are functioning correctly so that they're not pulling the joints out of alignment. The next thing we're going to work on is the fascial mobility. So fascia is the connective tissue that kind of covers everything. You have your skin, your subcutaneous fat, and then you have your fascia. You also have fascia that lines the muscles. It forms the slings that hold the organs in place. It is literally from the top of your head to the tip of your toes, okay? Fascia is everywhere. And it gets kind of sticky sometimes, and then it kind of holds everything together more than it should. So like you have fascia on the arm here, and it can kind of compress the muscles to the bone. And when that happens, it makes it hard for the muscles to be able to contract and relax. Also makes it hard for the joints to be able to move. So we need to make sure that your fascial mobility is correct in order for everything else to be able to move correctly and therefore stay put and function correctly. Now, why is the fascia and the muscles and the joints and the ligaments and the tendons, what's the big picture? Why is this all so important? It is so important because when all of these things are moving correctly, we have normal blood flow and normal lymphatic drainage. So blood flow brings in all the good cells that heal you, and normal lymphatic drainage allows your body to be able to process all of that. It's really important that we have this balance because your body is able to heal itself naturally. That's one thing that a lot of people think I have a magic wand and I can heal them. Don't tell them I don't have a magic wand. What I do is I get their body moving correctly so that their body is able to heal itself. Every tissue in your body was designed to be able to heal itself as long as it's moving correctly. However, if you don't deal with all the different layers, then you're not going to be able to get things moving correctly. So that's why it's important to see someone who can cover that whole spectrum of all those different layers. That's what we focus on with manual physical therapy. So hands-on treatment to all of these different tissues to get them moving correctly. Now, in a more traditional physical therapy, they're going to do that through exercise. And exercise is fantastic. I give my patients exercise to help accentuate what we've worked on in the clinic. So they're fantastic. However, if I give you an exercise and the joint and the fascia and the muscles are not moving correctly, then that exercise doesn't work the way it was designed because you cannot do it the way you're supposed to. And a lot of my patients have gone to a traditional physical therapy clinic and they do the exercises, but they actually increase their pain and they don't know why. Well, the why is because your tissues are not moving correctly, and what you're doing is actually creating more trauma. So with manual physical therapy, we focus on getting the tissues moving correctly so that they can heal, so that we can give you exercises that are geared towards, coordination or endurance or strength or whatever it is you need to achieve your goals. All right, what questions do you have about that? Drop them below, click like and subscribe on this so you hear more videos from us. And any questions you drop below, we'll make a video about that. Have a great day, everyone. Bye.